Welcome back guys. Now in this video let's discuss about diffusion and transport of gases. Okay, diffusion and transport of the gases. Now already we have discussed about the Fick's law. Okay, already we have discussed about the Fick's law. Fick's law tells us diffusion is dependent on which parameters? Diffusion is dependent on the concentration gradient of the gases, also directly proportional to surface area. But diffusion is indirectly proportional to the thickness of the membrane. For example, let's understand like this. See, here is the alveolus. Okay, here is the alveolus like this. Okay, here is the alveolus. Now here is the pulmonary capillary. Now let's imagine here the partial pressure. Okay, the partial pressure of oxygen here is 100 mmHg. Okay, now just for an example, in the blood vessel the partial pressure of oxygen is now 98 mmHg or 99 mmHg. Now my question is, will diffusion happen or not? Will oxygen diffuse from the alveolus into capillaries or not? Yes, diffusion will happen, no doubt, because here is high partial pressure and here is low partial pressure. The gradient is 2 mmHg, so diffusion will happen, no doubt, but little diffusion will happen. For example, here in the capillary, if the pressure is just 10 mmHg, 10 mmHg, now what will happen? Diffusion will happen or not? Above it is 100 mmHg, in the capillary it is just 10 mmHg. So what is the gradient? The gradient is 90 mmHg. So more diffusion will happen. So more the difference, more the gradient, more diffusion will happen, sir. So Fick's law is saying us that diffusion, okay, is directly proportional to the concentration gradient. If more is the difference, more diffusion will happen. In the same way, if surface area is more, normally alveolus are like a cluster of grapes. They are just like a cluster of grapes. But in conditions like emphysema, what happens? In conditions like emphysema, all that extra alveolar septa are damaged. So there will be one single voluminous alveolus. One alveolus will be there. Okay, actually it should be like a cluster of grapes. Okay, let me show you here. This is how the actual alveolus will look like. Okay, like this. But what happens in emphysema? In emphysema, what happens? Alveoli looks something like this. One single alveoli. All this extra septa is gone. All this extra septa is gone. Now what happened to the surface area? The surface area is decreased. When surface area is decreased, what happened to diffusion? Diffusion of gases will also decrease. So diffusion is directly proportional to the surface area, and diffusion is indirectly proportional to thickness. If you increase the thickness of the alveolar basement membrane, for example, let's see. Now there is this one condition where the alveolar basement membrane is getting thickened because of the fibrosis. Okay, because of the fibrosis. See, all here fibrosis is happening. If there is fibrosis, what happened to diffusion? Diffusion automatically decreases, sir. Simple. Okay, so if more is the thickness, diffusion decreases. Now let's see what are the conditions where there is abnormalities in the diffusion. First condition is alpha-1 antitrypsin deficiency. Whenever there is alpha-1 antitrypsin deficiency, that will cause emphysema. One of the congenital reason. Okay, congenital reasons for emphysema is alpha-1 antitrypsin deficiency. The acquired reason for emphysema is what? The acquired reason for emphysema is smoking. Smoking causes acquired emphysema. Alpha-1 antitrypsin deficiency causes congenital emphysema. Okay, of course the type of emphysema will be different. If I am a smoker, I will develop emphysema. Which type of emphysema? Centri-acinar emphysema. Alpha-1 antitrypsin deficiency will cause pan-acinar emphysema. So different types of emphysema are there. But here at the end of the day, in emphysema, sir, what happens? Alveolar basement membrane is damaged. Surface area is decreased. So diffusion decreases. So remember, in emphysema, obstructive lung disease, in the previous videos we have discussed, the elastic recoil is decreased. So lungs become more compliant. The alveolus, okay, the alveolus in obstructive lung diseases, especially in emphysema, having more compliance because elastic recoil is less, elastic fibers are damaged. Compliance is more, but what is happening to diffusion? Diffusion decreases. Okay, in emphysema there is more compliance, but if I am talking about diffusion, diffusion is less. Now let's talk about the pulmonary fibrosis. Now the alveolar basement membrane is getting fibrotic. Now what happens? Thickness of the alveolar basement membrane increases, sir. If the thickness of alveolar basement membrane increases, automatically the diffusion of gases decrease. So diffusion of gases decreases. Okay, even compliance decreases. Okay, even in pulmonary fibrosis, compliance also is less. Now after this, let's discuss about some important points about the diffusion. How we actually measure the diffusion? Okay, in lungs. Diffusion is measured with the help of a study called as DLCO. Diffusion in lungs using carbon monoxide. Diffusion in lungs using carbon monoxide, not carbon dioxide, carbon monoxide. Why we are using carbon monoxide? Why? Because it's a better molecule, ideal molecule. Carbon monoxide have 210 times more affinity for the hemoglobin when compared to oxygen. It's having more affinity. So we can get better results. We can know how good the diffusion is happening. Okay. Now let's see here. I have taken an alveolus. Now which gas I am using? I am using carbon monoxide. Here is a blood vessel in which hemoglobin is there. Now hemoglobin have more affinity for the carbon monoxide. Okay. Hemoglobin is coming via the blood, or RBCs are coming via the blood. Now let's see what is the normal diffusion lung capacity. Okay. Normal diffusion in lungs. Okay, if you use carbon monoxide, the diffusion is 25 ml. 25 ml of carbon monoxide is going to diffuse in every minute for 1 mm Hg pressure. With 1 mm Hg pressure, okay, now 25 ml of carbon monoxide is diffused into the blood vessels or into the hemoglobin, Now what are the conditions in which the DLCO, okay, the conditions in which the DLCO, okay, this is DLCO is increased, and conditions in which the DLCO is decreased. How to understand, sir? See, now RBC molecules, they are just like a carriers, they are just like a vehicle. RBC molecules will come here. Okay, this is our RBC molecule, try to understand. This is an RBC molecule, it's coming here. Now what it will do, inside the RBC there is hemoglobin. That hemoglobin will bind the carbon monoxide and it will go. Okay, from here it will go like this. Now here what I am trying to put in your mind is, if more number of RBC molecules come means, there will be more diffusion. More easily the carbon monoxide is getting into the blood and it will be going in the blood. Now, so the conditions in which DLCO is increased are polycythemia. What is polycythemia? Polycythemia is a condition where there is increased number of RBC. If more number of RBC are there means more number of RBC are going to the lungs. If more number of RBC going to the lungs means easily they will take up the carbon monoxide. Readily they will take up the carbon monoxide and they will go. So what happened to diffusion? Diffusion is more. Now, in the conditions like exercise, in exercise what happens? Now the person needs more oxygen, there is more oxygen demand in the body. Now what happens? Blood vessels will dilate, more blood is going to the lungs, for the purpose of oxygenation. So, more blood is going to the alveoli. Right now in the alveoli who is there? Carbon monoxide is there. Okay, so more blood is going to the lungs, which means more RBC is going, more hemoglobin is going. So readily the carbon monoxide will be uptaken. So DLCO increases. The conditions in which the DLCO is decreased. DLCO is nothing but diffusion, right? The conditions in which diffusion is decreased. Exact opposite, anemia. In anemia, less amount of hemoglobin. Less amount of hemoglobin means less vehicles are going to the lungs to catch up the carbon monoxide. Less vehicles are going, less hemoglobin is going to the lungs. Okay. Now, in the conditions like emphysema, already we have discussed. In emphysema, what happens? Surface area decreases. So, automatically diffusion decreases. In pulmonary fibrosis, what happens? The thickness of the membrane, alveolar basement membrane increases. So, what happened to diffusion? Diffusion decreases. So, automatically DLCO decreases. So, here I have discussed the conditions in which the DLCO is increased and DLCO is decreased. Okay guys, hope the video is helpful. In the next video, we'll start with the transport of oxygen. How oxygen is transported from the lungs to the tissues. Thank you.